Hello everyone. Today we will be presenting reasons as to why MMP Public Library needs to have a home delivery service. MMP's public library is located in an urban setting of a population of about 15,000 people. The city makes up about 20 miles wide, and the average income per person is about $31,000. Therefore, the median household income is around $69,000. There are approximately 1,500 seniors that live in the community. This means that 10% of our population of the city is seniors. Of those 1,500 seniors, it is estimated that 1,000 of them live alone and 500 of them live in a senior facility. The city, as we know, has 2 senior living facilities that house approximately 250 seniors each. We do know that these facilities do have a small library, but we are very unsure of how they're being handled. Based on those statistics, we feel there is a need for this home delivery service. Due to the fact that the senior living facilities have small libraries, and we know they do not have updated materials, the library could deliver new materials that they can enjoy. Not only would our service help those who are living in senior living facilities, but our service would expand to those 1,000 seniors living at home. Knowing not every senior would take an interest in this service, as they like their independence, but we could be of assistance to them when they have medical issues. This would not only help those with medical issues, but those who are just having one of those days of not being able to move and get out of the house very easily. We know we have a start to this home delivery service with patrons as they have been asking for a program like this. Not only would we be helping seniors in our community, we would also be providing this home delivery service to new parents. Believe it or not, new parents have requested this service as it helps with their schedules of being able to take care of their new babies.
The staffing and facility needs for this delivery service will be a full-time outreach librarian that has support from the adult services team, and this librarian will also act as the liaison to the community because they'll be the ones setting up the deliveries and the pickups and all that. The facility needs will be a dedicated space, even something as simple as a cabinet, to store and organize the delivery items before they go out. Budgetary needs. So this library received a $2,000 grant from the Metro Detroit Book and Author Society. This will be used to reimburse the cost of gas for the employees who are doing the deliveries. And they will also buy the totes to transport the books in. Hopefully, as the service picks up, the gas costs will go away because it'll be more volunteer-based, taking the books and out to people and picking them up. The technology needs for the service will be a computer and a cell phone to communicate with patrons. We'll also need LS2 from TLC in order to turn on the lending history for each person's account so they don't get the same book multiple times. And then we'll also need Google Sheets or an Excel spreadsheet to keep track of the patrons who are taking part in this service and their delivery preferences.
Now that we know the community could benefit from this service and what we require to provide it, let's talk about how to get it off the ground. Before patrons can even sign up for the service, they need to know that it exists. Our most immediate means of advertising a new service to patrons is through media we control: our website, monthly newsletters, and social media pages. Those are great ways to reach patrons who are already using our library, but we also need to connect with patrons who aren't. We can reach out to the local newspaper and radio station to see how they may be able to help us expand our advertising. We can also contact activities directors at facilities like hospitals and senior living complexes, as they'll be able to easily identify patients and residents who might use this service. Patrons will need an active library card to participate in this service. If they do not have one, they can register for one when they apply for the service. The required forms will be available online, but can also be mailed to a patron or picked up from the library by the patron or a caregiver or relative. Once these forms are returned to the library, the outreach librarian will contact the patron to set up an initial visit with a staff member. During this visit, the patron and staff member will establish a schedule for future deliveries and determine what the patron's material and reading preferences are. Patrons may choose to receive deliveries either once monthly or every other week, depending on the volume of materials they request. This schedule does not line up with the circulation cycle, so there will be no overdue fines assessed on delivery materials. However, any items not returned within 3 months of checkout will be assumed lost, and the patron will be billed for the item. Patrons must be home to accept delivery and will receive a reminder phone call from staff the day prior to delivery. Pets will need to be contained prior to staff arrival. As a precautionary measure, we want to make sure that staff members completing deliveries feel empowered to refuse a delivery if they feel unsafe or uncomfortable. Should this occur, the staff member will need to speak to the outreach librarian and branch manager about the situation. The outreach librarian will follow up with the patron to review the guidelines for ensuring staff can safely deliver materials. If the patron escalates the situation, the branch manager may inform the patron that they are not eligible for the service. This service will impact the outreach librarian and the adult services department staff members. Initially, staff members will take turns delivering materials. The outreach librarian will create a schedule of deliveries at least a month in advance so that staff have adequate time to plan around vacations and other obligations. Should the time commitment become too much for staff, we may consider implementing a volunteer program for the service. This service is going to fill a need in the community that is currently not being addressed. We know that there are people in our community who cannot visit us in person to use our services. By providing home deliveries, we can continue to connect them to the library as well as to their community.